Hi, this is Dr. Story. I'm going to give you one movement and one exercise that can significantly help you heal your bulging disc and sciatica. Now let's define what we're talking about here. It's important that you make sure that you actually do have sciatica coming from a bulging disc. On YouTube, sciatica can mean anything. Anything that's being pain down the leg, people call sciatica. There's many causes of sciatica. The word sciatica simply means pain down the back of the leg along the sciatic nerve. A piriformis can cause that. Adhesions between the superior gemellus muscle can cause that. Inflammatory conditions or just around the sciatic nerve can cause that. As the nerve goes through down the leg, it can be impinged upon through muscles, fascia, a number of things. You can get sciatic types of pain through facet syndrome, of which this particular exercise will not work for it. We're talking about a specific problem called a bulging disc or a herniated disc. And what happens is a person will have back pain that's radiating down into the buttocks, down the back of the leg near the hamstring, into the calf, and down into the toes, that's causing a numbness, a tingling, a burning sensation, or just lack of feeling into the feet. So let's get started. Let me show you this one exercise, and this is called the Mckenzie Protocol. So here we go. So here's what you're going to do. You're going to get up, you're going to lie down on the floor, you're going to get up on your elbows. And this is a beginning posture. And what happens here is you should notice after about 2 to 3 minutes that you're getting less pain down into the leg. Now, if the pain starts to become a little more intense into the low back, but there's less pain in your actual leg, this is a positive thing. This is something that you want to happen. This is called centralization. It means that the pain is actually improving. If the pain in this position starts to make more pain in the leg and less pain in the back, that is a negative thing. Then you would simply not progress with this exercise. Here's what we're going to do to continue. What you'll do is you'll get up into a push-up position, but when you do a push-up, you'll do what I tell patients is called a lazy push-up. You're going to keep your back arched backwards. So from the front, it looks like this. You'll get in this position, and then you'll simply arch up, keeping your pelvis on the ground, hold this position, and then relax down. You're going to do 10 repetitions. Go up real slow, hold this position, and then go down exactly at this speed. So from the side position, you simply get into this position, push up, hold that position, and then go down. Push up, and then go down. That is the single most important exercise. I'm going to give you an extra exercise to do. The first exercise is geared towards the bulging disc. The second exercise I'm going to show you is something that helps reduce the strain on the disc. It won't have as much significant improvement in your symptoms, but in the long run it's going to be beneficial. And what you're going to do is you're going to stretch your hip flexors. You're going to get into this position where it's a 90, your knee here is 90 degrees, this is 90. And what you're going to do, you'll see that your hips are a little bit arched. So if your back is arched like this, what you're going to do is you're going to take your belt, if your belt is tilted this way, you're going to pull it like this. So the belt is level. So you're going to be sucking in your pelvis, flattening your back a little bit to a neutral position, and then standing up nice and tall here, just like this. And then you're going to take and stretch your hip forward in this position, just about 10 degrees, and you'll feel a pulling sensation in the front here. That's what you want to feel. You hold this position for about a minute, switch sides, and that's an extra for you. Now this Mckenzie Protocol should be done every single day. Now how many repetitions do you do? The answer is 10. How often do you do it? When a patient has an acute disc injury and a bulging disc, if they get centralization of their pain, then what I recommend is to do it every hour on the hour when you're awake. As the person starts to improve, which can take a week or two, what ends up happening is then we'll reduce it to once every other hour. You don't want to actually overdo it, but if it's centralizing the pain, it's reducing your pain, reducing the sciatica, and over time, this is going to help heal the bulging and herniated disc. So if you like this video, give me a thumbs up. If you found it helpful, keep doing it. If you have any specific questions about the Mckenzie Protocol, ask in the comment section below, and I'd be happy to answer it for you.